So let's talk about menopause and sleep. This tends to be probably one of the biggest concerns that most of my patients come to me for is that they're just not sleeping and that impacts everything. Like we said before in one of our slides, good sleep begets sleep. So, what is good sleep? It's going to be 7 to 9 hours of uninterrupted sleep. It's really vital for longevity. It's really important for overall health, and it's also really important for weight. A lot of my patients also see me for weight concerns during this transition, and when they're not getting good sleep, this really impacts it. So, why is it so important? Over time, this disrupted sleep can lead to all kinds of medical conditions: high blood pressure, insulin resistance, metabolic syndrome, weight gain, a lot of the things that Jackie's going to talk to you about in that menopause and weight slide. We may also see mood disturbances, headaches, fatigue, decreases in our cognition, and again, high risks for cancer. So that is why sleep is so important. There's also things such as sleep disorders. You have your primary disorders, which are going to be obstructive sleep apnea, as well as central sleep apnea. And oftentimes these are really underdiagnosed in females. So it's a lot of times when I can't get things adjusted with hormones and with a thyroid and ferritin and looking at all the different things, a lot of times I'll recommend for my patients to get a sleep study. So something to empower you with to talk to your healthcare provider about. The secondary effects of sleep disorders can be things such as depression and anxiety. If you're a shift worker, if you do night shift and things like that, your night sweats, those are going to impact your sleep. You wake up in the middle of the night and you're hot, that's going to affect your sleep quality, as well as insulin resistance, diabetes, any kind of pain that you have. Those are all things to think about which are going to impact sleep. So let's talk a little bit about sleep and this menopause. According to the National Sleep Foundation, 61%, a ton of menopausal women have sleep problems. And I bet you it's even more because some women leave just going undiagnosed with their menopause or told to suck it up and deal with it. These disruptions can be due to a variety of things that happen from that reduction of your estrogen and progesterone. The night sweats, waking you up in the middle of the night, the anxiety, keeping you from falling asleep, the weight, which we're going to talk more about in the weight loss lecture, as well as just that dropping progesterone hormone. That's that first hormone that you've heard me talk about that goes during this transition. What about menopause and sleep apnea? 1 in 5 women actually have sleep apnea, but it's so underdiagnosed. Nocturia, so waking up in the middle of the night to pee, is also a really big clue that this may be happening. Your postmenopausal women are 2 to 3 times more likely to have these sleep apnea compared with your premenopausal women. So just something to think about with aging. Before we become menopausal, we're fairly protective, but the protective effect of our hormones seems to be what gets lost in this menopause transition. So really important to think about. Women often have these subtle symptoms way different than men, and that's why we're empowering you to talk to your providers about that, because they may be less likely to diagnose it. Also, there's this restless leg syndrome. It's a condition that's often caused by just these uncomfortable movements in the legs, and women who have been previously diagnosed with this often have worsening symptoms in their menopause, and that of course impacts their sleep quality. In order to see diagnostic criteria for this, it's an urge to move accompanied by an uncomfortable or unpleasant sensations in the legs. It begins or worsens during periods of rest or inactivity, like lying or sitting, and symptoms may be completely relieved by movement. Iron treatments if the patient's anemic, or ferritin levels, which we're going to talk a little bit about, and maybe even some gabapentin to discuss, but this sometimes is something that will keep people up in the middle of the night. This is just a slide that we've put here about how to prepare your day for sleep and more sleep soundly at night. We talked about it in the lifestyles lecture, but things around just really good sleep hygiene and focusing on using the bedroom for sleep and sex, and that's it, and making sure that you have a sleep time regimen and taking off all electronics and other things as well too. So how do you get better sleep? Again, bed is for sleep and sex. Exercise is going to help if you can get that in every single day. We talk about that in our movement, bones, and lecture slide. Evening needs to be kind of a wind down. You want to kind of curate something around this environment, maybe a cooler room, because that definitely helps so that you're not getting warm. A lot of us are waking up in that menopausal years just sweating and drenched and hot in the middle of the night, and that affects it. Mindfulness and meditation, and have some sort of routine. There are a lot of apps out there for that. Calm, Headspace, those different things. Removing pets from the room. They can really interfere with our sleep quality. And maybe switching rooms if you have a disruptive partner that may snore. And then again, some cognitive behavioral therapy may play in there as well. In terms of supplements for sleep, magnesium glycinate is really great. It also kind of helps keep bowels consistent if constipation is an issue. Looking at different kinds of melatonin, CBD products, inositol, L-theanine, those are all wonderful things to be looking at. You want to avoid medicating with alcohol for sleep, as it really can be a sleep disruptor, so things to think about. In terms of prescription, if you feel like you need a prescription for this, it's really important to talk to your healthcare provider. You really want to try to avoid the Ambiens, the Lunestas, and your benzodiazepines if you can. Really talk to your provider. We want to empower you, especially after that hormonal lecture around the need for progesterone. 100 to 300 milligrams. It really stimulates the brain to kind of really produce those calming neurotransmitters called GABA, which really does help with sleep. Amitriptyline and SNRI, a selective I can't even talk today. Selective norepinephrine releasing inhibitor. That's another type of medicine that can help with sleep. Also trazodone, that may be something to consider. Busbar, but these are things that you want to talk about with your healthcare provider. Usually we will recommend trying over-the-counter things first that you saw from the other slide, and then kind of reaching back out to some of the things as well. We look forward to seeing you in the next slide set, Menopause and Mental Health.